Welcome to 52 Questions. I am Shannon Weber, Director of Hive. Every year, Hive answers hundreds of questions from patients, from partners, and their providers. And each week in 2018, we're bringing one of those frequently asked questions to you in video format. And for this week's question, we have a very special guest, Dr. Deborah Cohan, the Medical Director of Hive, who first prescribed PrEP during pregnancy, by the way, in 2011. To answer this question that we have gotten since 2011, is PrEP safe during pregnancy and breastfeeding? And we have other 52 question videos talking about what PrEP is, and we can link to those. So if you can talk about the specifics of it related to pregnancy and breastfeeding.
Yes, thank you, Shannon.
Mm-hmm.
It's a pleasure being here with you. And thank you all for tuning in. The very short answer is yes, we think that PrEP is safe during pregnancy and breastfeeding, but I can dig into that a little bit more. The medications that are used for PrEP, it's this medication called Truvada, which actually is two medicines combined into one pill. It's taken every day. That medicine has been used by pregnant women for many, many years at this point. It's been used both in the setting for women living with HIV who are pregnant and also women living with hepatitis B. Mm-hmm. So it's been used in both settings during pregnancy and also during breastfeeding. So we actually have quite a bit of information from research studies and also just from people using it in clinical practice. And I should say there also is more and more data looking at the use of Truvada as PrEP, specifically for pregnant women and during breastfeeding. And the vast majority of the information we're getting indicates that it's safe. There were a few earlier studies that suggested that maybe women who took PrEP during pregnancy, or I should say actually who took Truvada during pregnancy to treat their HIV, those women delivered babies whose heads initially were thought maybe to be a little bit smaller. We didn't think it was actually so much smaller that it was a problem. Mm-hmm. And more recent studies are very reassuring that we have more people, more women, more babies. So again, the short answer is we think it's safe during pregnancy and breastfeeding. One other thing I just want to say is whenever a woman takes anything during pregnancy or breastfeeding, it's always balancing risks and benefits. So while we think the risks of taking Truvada, taking PrEP during pregnancy and breastfeeding are low, if her risks are even lower, if her risks are zero, for instance, there'd be no reason for her to take it. So if a woman truly is not at risk of acquiring HIV, and ultimately only the woman can make this decision, but we don't, for instance, routinely recommend that pregnant women or breastfeeding women take Truvada, take PrEP, just the women who may be exposed.
And then I'm curious, because it does sound like it's such a thing to weigh the risks and benefits in your experience with talking with women for all these years. Is it a decision you make once and you live with it, or how do people experience that? Because it feels like as women during pregnancy and breastfeeding, we change our relationship with our provider, our partner, our experience with having a child.
Yeah, absolutely. I would say oftentimes women have seasons of risk where maybe they're with one partner and they're not at risk of acquiring HIV, and then they change partnerships. And, excuse me, off screen, back, stay with us. So that they may have times in their life when they are at risk or they are unsure. And those may be times when Truvada feels like a good idea. So it may be that they know their partner is living with HIV. It may be that they think their partner is taking HIV medicines, but they're not totally sure. There's no way for them to confirm, so they have some control over the situation by taking Truvada PrEP. And women, even if the circumstances don't change in their life, women's sense of what risks they're willing to take or not take may change over time.
Right.
So I certainly encourage women to stay open and also to not judge themselves if they notice their mind changing. Like that's part of being human, is our opinion changes.
Great. Thank you for joining us this week. Tune in next week where I'll answer the question, is methadone safe during pregnancy and breastfeeding? Have a good week.
Bye.